Do you know a child who is suffering from ADHD? This short video is here to teach you more about the disorder so you can understand it better. We are going to look at the symptoms, the effects on a child's life, and recommended coping strategies. First, let's define the term ADHD. ADHD stands for Attention Deficit Hyperactive Disorder. Some people have attention deficit disorder without the hyperactivity. This is often called ADD. The term ADHD can be used for both disorders as they are the same except some people lack the hyperactivity. Childhood ADHD symptoms include restlessness, hyperactivity, inattention to detail, impulsiveness, excessive misbehavior, and difficulty in school. There are social problems that often occur as a result of ADHD, in part due to it being a misunderstood condition. This still occurs despite the large numbers of people suffering from this disorder. Much scientific research has been done over recent years. Research has included brain imaging scans that found visible differences in people's brains with ADHD in comparison to those without. ADHD is a neurological brain condition. Suggestions that ADHD is a made-up condition or a result of bad parenting or lack of control can be very hurtful to the child as well as the parent. The effects of ADHD on a child's life are vast and can continue into their adult life. A negative self-image can grow from ADHD and remain later in life. This is due to their difficulty in school, social problems, possibly including rejection, and a tendency to act out or speak out of place. Innate skills and talents may be undeveloped in childhood as a result of the disorder. People with ADHD also have an ability called hyperattention, where they can zone into things, but only if they find them very interesting. For some, this leads to excessive use of computers, video games, and television. The child's disorder also affects parents as well. The child's chronic misbehavior can lead to frustration, stress, and anger. A parent can feel as though they are to blame for the child's misbehavior and feel as though their parenting skills are inadequate. This is unfortunate, as a parent is not to blame for the child's behavior or condition. Children with ADHD are more difficult to parent, and their misbehavior is a result of the disorder and not of bad parents. Regardless, there are specific ways to help ADHD children. They benefit from having parents that are consistent, encouraging, tolerant, well-organized, and work on a regular schedule. More parenting tips can be found on www.naturalattention.com. There are many different remedies to help subside the symptoms of ADHD. Some people have a positive outlook on prescription drugs for the disorder, where others are more skeptical of them or have experienced negative side effects. Prescription drugs usually help subside the symptoms of ADHD. When a child takes them, they usually do better at school and have better behavior. Unfortunately, there are some health concerns with the prescription pills, and many people report changes in their child's personality. Adults who take the prescriptions often claim to feel a little stoned, dulled down, and at times experience anxiety. Children on the medication often appear to exhibit those symptoms. Prescription medication can be helpful, but should be seen as a last resort. Sugar and carbohydrates affect the brains of people with ADHD differently than those without. A child's symptoms will lessen on a low-sugar, healthy, wholesome diet. Studies also found dyes and chemicals increased ADHD symptoms, particularly red dye. Even with a wholesome diet, children will need proper supplements. Studies have found that this can result in a complete loss of symptoms. These can work just as well as prescription drugs, at times better, but without the side effects. It is highly recommended that one tries this prior to going on prescription medication. Naturalattention.com supplies information on supplementation that has the best results, as well as more parenting tips and ADHD information.